Good evening, everyone, and welcome to today's session. Karthik 001, Sardar Singh, Anu, JD, and many more who are all joining the quiz. So please quickly join our WhatsApp group where the link is being posted, the quiz link. And being part of our WhatsApp group, you also get an opportunity to listen the upcoming quiz announcements. So across the day, we have many more quizzes. So a quiz tournament stimulates you, excites you, instigates you. You can add another 10 adjectives. Fundamentally, that will make you to wake up from the sleep and then take the challenge. So, doctor, almost 13 online. I'm supposed to start at 11:45. Yeah, bit late. Yes, you have very good questions. Get ready with the smartphone in your hand. On the smartphone, get into the quiz through the link. And you can join through the in the WhatsApp group. You also have that link. Yeah. So, चलो भैया शुरू करेंगे रेल गाड़ी को. Yes. Very good. Good. Almost 15 online. We'll wait one more minute before we start the train. Murali Bharadwaz midnight Masala Medicine Quiz train शुरू हो रहा है. गाड़ी सीटी बजा रही है और चिक 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 शुरू हो रहे हैं. और आप अपने साथियों के साथ कंपटीशन में स्पर्धया वर्धते विद्या. Only when you are competing, you know how others are studying, where you are weak, where you are strong. So simply studying alone is not enough to be challenged every moment. And to get that habit of quickly picking up the right answer and throwing the ball, you should get that practice by playing quizzes with Dr. Murali Bharadwaj. Very good. Now, गाड़ी शुरू हो रहा है. 3, 2, 1. We have 31 questions in medicine. Punch your answer, doctor. What is wrong about precocious pseudo-puberty? Is the question of the examiner. Precocious pseudo-puberty. Yes, 6 of you are right. It is gonadotropin independent. There is an enhanced estrogen formation, and there are anovulatory cycles that characterize the precocious pseudo-puberty. Good. JD is on the top. Sardar Singh is our new benchmate, roommate, classmate. So gonadotropin independent precocious pseudo-puberty occurs whenever the girls undergo feminization because of excessive amount of estrogen, but do not ovulate or develop any cyclical menses. That's the reason it is called pseudo-puberty, is what you need to understand. Good. Question number 2. The most frequent cause of precocious pseudo-puberty. Very good. Granulosa thick cell tumors. produce a lot of estrogen, which is underlying cause. Very good. Shweta is on the victorious note. So ovarian cysts or tumors that secrete estrogen, like granulars or thecal cell tumors, are the most frequent cause. Question number 3. Which is not a feature of incomplete isosexual precocity. So precociousness, where girls show feminine features, boys show masculine features very early, is precocious isosexual precocity. So there's a premature thylarch, premature adrenarche, and premature pubarch. Any of them can happen. No clitoromegaly. Good. Shweta and Sardar Singh are going to have swords, right? So let us see Bhagat Singh versus Jhansi Lakshmi Bai. Who is going to become the winner? Clitoromegaly is a feature of the syndromes of virilization, is what you need to remember. So it doesn't come under isosexual. Now, what is the recommended treatment of an incomplete isosexual precocity? Yes, doctor. Sarang, please join our WhatsApp group बेटा. वहां हम आपको क्विज लिंक मिलेगा. बराबर? So, generally there is no treatment required for a incomplete isosexual precocity. वरेबा हमारा राजपूत के तलवार अक्षय चौहान is on the top. Very good, very good. So usually incomplete isosexual precocity is self-limited. It resolves spontaneously and the patients enter the puberty around the average time. So that's the point. Now, question number 5. Good to see 24 online. All you guys need to do only simple thing, go to the WhatsApp link, joining link. Once you click and go to the WhatsApp, you can be able to get the quiz link which is posted there. Okay? So we want more of you to be part of our WhatsApp group. Great. So doctor, the most common primary dysfunctional uterine bleeding is the estrogen breakthrough bleeding. I know what is the wrong answer. Okay? So Akshay Chauhan looks like he's wielding the sword very strongly. Let us see who is going to be the winner of 40,000 rupees worth of online MBBS.com video library, mock tests and notes by standing on the top of the Dr. Murali Bharadwaz Midnight Masala Medicine Quiz every day. So, good doctor. Question number 6. Oh, Dilip is saying, sir, वो व्हाट्सएप ग्रुप के अंदर गया मगर कोई भी क्विज लिंक नहीं दे रहे हैं. 1 minute डॉक्टर. Quiz link. I will try to okay. All right. So I'll do one thing, doctor. I'll try to post you the quiz link. 1 minute. Okay. I'll try to post the quiz link right away. 1 minute. Midnight now. So our team is a very dedicated team generally, but sometimes the most dedicated people have lives to live. Okay, doctor, you are having that quiz link there. Please join using the quiz link. Yeah, this is the quiz link, doctor. Please join with the quiz link. Okay. So, doctor, primary amenorrhea, you call it whenever there's a failure of menarche at the age of 50. 1-5. Good. Oh my God. Most of you got clean bold. Only Chintu. Correct answer de diya. Chintu Viday. Very good. The only guy to correctly answer. Question number 7. See, such a simple question, but clean bold. Secondary amenorrhea is the failure of menses for how long? For how many months? For how many months? Secondary amenorrhea. Very good. For up to 6 months, failure of menses is what you need to remember. Very good. Using the link, 24 people are able to join. I'm so happy. Good. Only Sardar Singh correctly answered. Amenorrhea is failure of menarche by age 15. And absence of menses for 6 months is called as, in a woman with previous periodic menses, is called secondary amenorrhea. Question number 8. Wolfram syndrome. What does it consist? Yes. Wolfram syndrome. Beautiful question. Oh, only 5 of you gone correct. See, आप देख रहे हैं ना कितना simple repeatedly asked questions भी हमारे हाथ से we are losing it from our hand. That should not happen in tomorrow's exam. Okay? Congenital diabetes insipidus and diabetes mellitus. Both of them is called Wolfram. Good. Question number 9. DiGeorge syndrome consists of which of these following features? DiGeorge. So, DiGeorge consists of hypoparathyroidism. Good. So, it is due to the agenesis of the parathyroid along with mucocutaneous candidiasis is called as DiGeorge. Question number 10. Kearns-Sayre syndrome include all these features except Kearns-Sayre syndrome. Great. So hypoparathyroidism, primary hypogonadism, and panhypopituitarism. This combination is called Kearns-Sayre. Good. Ash is quickly picking up. Now, question number 11. Enhanced androgen production क्यों होता है polycystic ovarian syndrome में? What is the main reason? Good. It is the synergistic action of insulin and LH. So, the sex hormone binding globulin is synthesized in the liver. Mainly androgens and insulin show their effect. And because there is a decreased SHBG, there is an excess amount of free unbound testosterone that lead to hyperandrogenism that you see in case of polycystic ovarian syndrome is what you need to remember. Question number 12. Chronic anovulation with estrogen present is found in all. There is a high estrogen and also chronic anovulation. That is a scenario in Brenner's, hypothyroidism, and Krukenberg's tumor. In all these three, there's a chronic anovulation and estrogen is also there. Sardar is on the top. Very good. Now, hypogonadotropic hypogonadism also, there is an anovulation, but the estrogen is absent. Question number 13. In PCOD, LH to FSH ratio characteristically is more than how much? Bravo! More than 2 is what you need to remember. That brings Ash to the top. Great. Question number 14. Chronic anovulation with estrogen present is found in all these things except so in the ovarian tumors and the adult onset 21 alpha hydroxylase deficiency, there's a chronic ovulation with estrogen. But Calman's is a hypothalamic underlying cause for hypogonadism. Hypogonadism means low estrogen. So that's the point. Good. So Calman is isolated hypogonadotropic hypogonadism with a defect. It is Cal gene and it is X-linked is what you need to remember. If a woman having PCOD is not hirsute and does not desire pregnancy, what is the treatment of choice? Treatment of choice. So this shows how much of endocrinology, especially gynecological endocrinology. If you have done a lot of questions wrong, this should give you inspiration to go back to online MBBS video library and do the revision of gynecological endocrinology. Very good. It will be medroxyprogesterone acetate becomes the treatment of choice. Very good. Sardar, Abhijit, correctly answered. Ram also, very good. So, medroxyprogesterone acetate prevents the development of endometrial hyperplasia and carcinoma by bringing about withdrawal menses. That's where we use it in the treatment. Question number 16. If a woman with PCOD is hirsute but does not desire pregnancy, then what is the treatment of choice? So all these combinations of the PCOD treatment, you have to be 100% sure. Great. We have to give combined estrogen progesterone therapy in that scenario. Very good, Sardar Singh. So estrogen fundamentally is anti androgenic in nature. That's the point you need to appreciate. Question number 17. So all these drugs have anti-androgenic effect, except what? Anyone who answers this is a super guy, let me tell you, in endocrinology. Only 5 of you correctly answered. Cypridione acetate, estrogen, drospirenone. All of these things are anti-androgenic, not gonadotropin, which is basically GnRH. Oh, Sardarji has fallen down. Akshay Chauhan, hi, Chintu, correctly answered. Sonal also. Very good, Sonal. Now, so cypridione is anti-androgenic by inhibiting the androgens from binding to the androgen receptors. Estrogen suppresses the LH, hence it will decrease ovarian androgen production. Estrogen also increases SHBG, sex hormone binding globulin, so that free form of testosterone become low. That way it is anti-androgen. Drospirenone is an analog of spironolactone, and it has got anti-mineralocorticoid and anti-androgenic effects. That is what you have to appreciate. Question number 18. Teratogenic effect of which drug lead to neural tube defect? Easy question. Spotter. Fatafat bolo, doctor. Great. It is carbamazepine. Question number 19. I think this is a repeat. Is it a repeat? No. One more question on neural tube defect, etiological factors. Great. It is valproate. Valproate. Good to see Priyanka Raghavendran and God love you, Thomas. Hey guys, you can still join the quiz. This is the quiz link. You can, on the smartphone, can join and play. Great, Sardar. Question number 20. Epstein's anomaly is a teratogenic effect of which drug? I think all of you will correctly answer. Lithium. Very good. Good to see Pramod Gurjar. Pramod ji, आप a WhatsApp group link से WhatsApp में join होना. Please use this WhatsApp group link of our quiz tournament group. Yes. Excellent. 21. Teratogenic effect of which drug lead to Mobius sequence? Super. It is the misoprostol. Great. So Sardar, Ash, Avijit, Basha, and YY. There is a tug of war. Let us see who will win. So congenital paralysis of the abducens and also facial nerve. याद रखेगा ना? Congenital bilateral paralysis of 6th and 7th, along with odontological, craniofacial, ophthalmological, orthopedic combination is Mobius sequence. 22. Which drug's teratogenic effect can be Dandy Walker syndrome? These questions straight ditto आएगा कल के नीट पीजी एफएमजी में, तब डॉक्टर मुरली भरद्वाज याद आएगा. Excellent. Warfarin. Great. Only Avijit correctly answered. 23. Teratogenic effect of which drug produces aplasia cutis? Aplasia cutis. Who is going to answer? Super. Methimazole. Methimazole can lead to aplasia cutis. Great. Chintu Basha, Avijit Ash, Sardar, everyone correctly answered. 24. Teratogenic effect of which drug produces necrotizing enterocolitis? Fatafat bolo Babuji. Super. Super macha. NSAIDs. Absolutely. Great. Ash and Sardar Singh are on a fist fight. Let us see. 25. Decreased skull ossification is the teratogenic effect of which drug? Decreased skull ossification. Computer Mahoday, lock kiya jaye. Angiotensin converting enzyme inhibitors can lead to, which are strictly contraindicated in pregnancy. Super dupero. Ash and Avijit Basha correctly answered. Gautami, very good Gautami. Karthik, Supero. Ram, Supero, very good. Now, 26. Masculinization of the female fetus is a teratogenic effect of which drug? Very tempting options, mainly between B and C. Absolutely. I told you that B, C के बीच में ही सब लोग लड़ेगा. It is the danazole. Sardar Singh is really doing good. 27. Renal tubular dysgenesis is a teratogenic effect of which drug? Bravo! ACE inhibitors. ACE inhibitors. Sardar could not answer. Ash has answered. Very good, Ash. Karthik, excellent. Ram also. I Singh. Shiva, correctly answered. Great. 28. Retinoid embryopathy caused by teratogenic effect of isotretinoin therapy. What are included in that? In retinoid Embryopathy. Good. Optic nerve blindness, thymic defects, and spontaneous abortion. A little difficult question that was. Chintu is lucky enough to answer. Last two questions going to decide who is going to get 40,000 rupees winning prize of onlinembbs.com video library. Fetal hydantoin syndrome caused by teratogenic effect of phenytoin. What are all the components of it? Great. A short nose with a broad nasal bridge. Epicanthic folds, webbed neck. They're all the part of the fetal hydantoin syndrome. Only one correctly answered. Who is that one? Who is that one? It is the one and only Bem. Bem Bem Bom. Last two questions. Fetal warfarin syndrome includes all except Kaumarin syndrome. Great. I told her, Dandy Walker malformations, warfarin, don't forget. Walker, warfarin. Walker, warfarin. Hearing loss, agenesis of corpus callosum. Great, great. Sardar, दिख रहा है, Sardar is the, Dr. Sardar Singh is the Prince Charming of the today's evening. Let us see. Last question will decide. 31 out of 31st question. Everybody will answer this. Fetal Minamata disease is the teratogenic effect of which tract? Wow, in spite of 12:40 a.m., all of you joined Midnight Masala show in General Medicine with Dr. Murali Bharadwaz. Thank you all for doing that. And please inform your friends to also join in our WhatsApp group of the quizzing and subscribe to onlinembbs.com video library. Great, doctor. Great. Vareva, 1400 points. Sardar Singh. Jindabad. Excellent, doctor. I'm very proud. Sardar Singh, please take a snapshot of this screen and send it to our helpline. You know our number, 9000868-356. You can, I'm also typing here, 9000868-356. And keep playing, keep reading, keep playing, keep reading. Ideally, learning, education, preparation for exam is considered to be, should be played like a sport. So that is a whole idea. So, doctor, we reach the end of the game. I finish singing the lullaby for all of you to go to a happy sleep. You worked hard the entire day. Once more tomorrow, when you start back your preparation, 19 subjects, 953 topics. Most important than reading is to know what to read and to know where you are already good, where you need to improve, and where everybody is good, where you are not good. That is very important. But otherwise, life is more beautiful than all these exams, doctor. Good night and see you all tomorrow. Thank you.